I feel like, I don't know. Today we are doing a neurological and musculoskeletal exam. This is Daniela, and here we go. So we're gonna start by assessing the spine. So we have the patient standing in front of me here with the back towards me. I want to inspect and palpate spinous processes which should run vertically and in alignment. I also want to look for any abnormal lateral curvature which could indicate scoliosis. Then I want to take a look at the patient from the side to assess for kyphosis or lordosis, which is just exaggerated curvature. Next, I want to do range of motion. So I'm going to check cervical spine, have the patient put their chin up and down, her head left and right. Then I'm gonna have her put the head to each ear, the shoulder. Now I'm going to test the thoracic motion to have the patient lean side to side and then twist to demonstrate these motions for the patient if it helps. For the lumbar spine, I want to have the patient lean back. And then, of course, I want to support them while they do this. This should be done smoothly without any pain. Next, we're going to move on to the extremities. So I want to assess each joint starting at the shoulders. I want to inspect for the muscle size and shape. Are there any atrophy? What the condition of the skin is, any redness, swelling, any masses, deformities. Then range of motions for the shoulders. This involves abduction, adduction, forward motion, backward motion, rotation, and shrugging. I also want to make sure that I palpate the joints during the range of motion to see if there's any crepitus or any pain during. Now I'm going to repeat the same thing for the other side. Going through the flexion, extension, supination, and pronation. Then the wrist, also doing the flexion, extension, supination. The hands, again, same flexion, extension. Looking at the joints for any abnormalities, asking, of course, the client if there's any pain. I want to check the strength of upper extremities, have the patient push against, pull their arm towards themselves with resistance, of course. Now I'm going to have the patient do full range of motion. So one of the things that we want to keep in mind is that the score is 5 out of 5, meaning the 5 is what's expected for normal patients. Next, I'm going to start looking at the hips, work my way down. Should for flexion, extend. Also for the abduct and adduct, rotation internally and externally. Want to make sure that the patient is balanced during these movements. I want to assess for stability and, of course, check both sides. Then I'm checking the knees for flexion and extension. I can ask the patient to sit down while moving through these range of motions. Want to also check the dorsiflex, plantar flex, supinate, pronate, and rotate. And finally, they should be able to flex and extend their toes as well. Now we are going to do strength for the legs. These are often, again, done best when sitting down. I want to have the client push up against my hands, pull against my hands with resistance. So that completes the musculoskeletal assessment. And now we're moving on to the neurological. And we're going to start off by checking for orientation. And we want to do that by asking the patient about person, place, and time to see if know where they are. We want to make conversation with the client, asking them maybe for the full day, asking them general questions like the president. This gives us an idea of their overall mood and their affect. Also want to check the quality of their speech. So at some point you want to let the client know that you're going to be asking silly questions so that they can expect, to answer them. You want to ask questions such as comparing maybe an ocean to a lake, apples to oranges, something that gives an idea of where they are cognitively, maybe the seasons of the year. This helps to see their attention span, how their memory is, how their judgment is, and if they're able to follow a line of questioning. Once we're done with the interview, we can move on to the cranial nerve testing. First cranial nerve is the olfactory, so we have the patient close their eyes and ask them to identify a common smell. The best and most available option to you is an alcohol pad, so just have the package and wave it in front of their nose. Next, we're going to test cranial nerves 2, 4, and 6. These are all about the eyes, so you want to have the patient cover one eye at a time and read a visual acuity chart or just a sign on the wall across the bed. In this case, we want to test both eyes, so you can have and then do it both ways. Now we'll test the pupils and reaction of her eyes. So I'm going to do this by checking the conversions. So asking her to follow my finger back into her face. And also want to do the 6 cardinal movements. Just ask the patient to follow your finger with just their eyes and make sure that all the movements are smooth and coordinated. Once I've done that, now I can move on to the cranial nerves of the face. I usually start with cranial nerve 7, the facial nerve. I ask the patient to smile, to frown, to raise their eyebrows, to close their eyes tight and show their teeth, all while looking for symmetry from side to side. Then I'm going to do cranial nerve 5, palpate the jaw while the patient clenches their teeth so that I could assess TMJ. At this point, I want to check for any clicking, any crepitus, ask them if there's any tenderness or pain. Next is cranial nerve 12, and we're checking this by observing the client swallow while they're drinking something. This is another way to check for functionality of cranial nerve is asking them to do movements with their tongues, left and right, up and down. Next is cranial nerve 11, so we can have the patient shrug their shoulders and then turn their head side to side against resistance. That completes the cranial nerve assessments. Now we're moving on to sensory. Start off by asking the client if she has any tingling or numbness anywhere. So using the cotton applicator, one side is soft, the other one is sharp. I'm going to ask the client to look away or close her eyes so that she can tell me if she feels something that is sharp or soft. I want to do this in random parts of the body to see if she has sensation. You want to be unpredictable with your movements so that they can have a clear indication of where they're feeling it. So now moving on to reflexes, I'll grab the reflex hammer and explain what that is to the client. I'll start off by assessing the biceps and triceps. For reflexes, again, you always want to compare both sides so that you're able to see the reactions on each. Now moving over to assess the patellar and Achilles reflexes. This one, I'll have to have the client sit up on the edge of the bed. And so, again, I want to check both sides evenly, patellar and Achilles reflexes. The Achilles being on the back of the heel. Then I'm going to want to check the Babinski reflex by pulling the reflex hammer up to the lateral side of the foot. And I should see client's toes curl up. If I don't, obviously there'd be an indication there of some neurological deficiency. Now I'm going to ask the client to stand on their feet, to have their feet together, to close their eyes and to hold that position for 20 seconds. This is called the Romberg test. They should be able to stand without falling the whole time. Now a bit of a sway is totally normal, but if you want to put your hands in front of them and behind them so that they don't fall. Now we're moving on to the finger to nose test. So I'll ask the client to touch the tip of my finger, then her nose. Now move my finger and I'll ask her to follow it and go back towards her nose. And this was done to test ataxia or uncoordination. Lastly, I'm going to ask the client to walk away and walk towards me. This is assessing for gait and coordination. And this completes our exam.